6 Common Rookie Mistakes to Avoid When Wearing an Individual First Aid Kit. You pack the wrong equipment. You should have the proper equipment for the situation. Band-aids and painkillers have no place among the life-saving first aid supplies in the individual first aid kit or bleeder bag. Keeping the individual first aid kit in your vehicle. In a tactical scenario, you should carry the individual first aid kit with you all the time, meaning it should be connected to your battle belt or chest rig. It must be carried with you at all times, otherwise, it is not an individual first aid kit. The individual first aid kit is in disarray. It is necessary to keep individual first aid kits in order. When you open it, you do not want gauze all over the place. It is inaccessible. You should be able to reach your IFAK with both hands. If you need to carry it in a backpack, try to secure it to the outside. The IFAK has inexpensive supplies. Be careful with individual first aid kits that have not been tested. Some large retailers try to pass off an item as an individual first aid kit when it is really a pack of band-aids. Your individual first aid kit is not labeled. This is critical in tactical situations. If an accident happens to you, someone will usually come to your aid. They cannot help you if they cannot find your individual first aid kit. Medical patches are smart. If you like the content of this video, click the subscriber button so you can keep yourself updated with topics like this every week.